Distinguished participants, Excellencies, ladies and gentlemen, it is my honor to address you on the occasion of the International Conference on Biorisks, Biosecurity and Biological Disarmament. At the outset, I would like to express my sincere thanks to the United Nations Institute for Disarmament Research, or UNIDIR, and the World Health Organization, WHO, for co-organizing this timely conference with my office. This important initiative will enable us to discuss the mounting challenges associated with biological risk and explore potential solutions. Ladies and gentlemen, we are observing a dramatic evolution in biological risks, with the security challenges posed by biological threats becoming increasingly complex. The COVID pandemic added prominence to issues relating to biological risks and demonstrated the catastrophic impact that infectious disease has on a global scale. The pandemic also demonstrated the disruption that could be caused if biological agents were to be used in a deliberate manner as weapons of war or terror. For these reasons, the pandemic brought into stark relief the importance of the Biological Weapons Convention, BWC, and the need for it to be fully operationalized, properly institutionalized, and fit for purpose. It is worth recalling that the BWC was the first international treaty to effectively prohibit an entire class of weapons of mass destruction. It's not only a pillar of disarmament and international security, but it also contributes to strengthening global health security. The effective implementation of the BWC can strengthen the attainment of the Sustainable Development Goals, as strong public health systems are a necessity to prevent and combat naturally occurring diseases. However, for this, the BWC needs to be strengthened and its institutional weaknesses addressed. The Convention does not have an international verification regime, nor its own separate international organization to facilitate the full and effective implementation of the Convention. The Convention operates on an annual budget of around $2.1 million and is serviced by a small 4-person implementation support unit based within the United Nations Office for Disarmament Affairs in Geneva. These institutional weaknesses need to be urgently addressed if we are to be able to deal effectively with the mounting challenges posed by biorisk. This way, we can ensure that the norm against the misuse of biology remains strong and ensure that the opportunities provided by rapid advances in science and technology are used only for good. The Convention's 9th Review Conference last year set out a new approach to strengthening the BWC, and discussions in Geneva have begun with a positive tone. Now is the time to work towards taking effective action on the topics agreed under the Working Group on the Strengthening of the Convention. I wish Ambassador Flavio D'Amico, in his role as Chair of the Working Group, all the best. My office, the Office for Disarmament Affairs, particularly through the BWC Implementation Support Unit, embedded in the Geneva branch, will continue to provide all necessary support to BWC states parties. Of course, while the BWC is a necessary and pivotal pillar of biosecurity, it is by no means on its own and by itself sufficient. We also need to consider the BWC within the wider framework of the international architecture to address and combat biological risks. One added value of today's conference is its convening of experts dealing with multiple aspects of biorisks and the international response to them, presenting an opportunity to connect the dots in our thinking on threats to global health security. It is therefore opportune that this conference is taking place in Geneva, where the health and disarmament communities can have more regular interactions. I hope that this event can help link the two communities better. While naturally occurring diseases will continue to present the main challenge, intentional use of disease as a weapon should not be ignored in these discussions. Distinguished participants, I am a strong believer in the need for comprehensive and cross-cutting approaches to global challenges, and in the unique role that the United Nations and relevant multilateral organizations can and should play. When confronting global challenges, therefore, we cannot limit ourselves to our traditional and comfortable bureaucratic silos. In the case of biological risks and global health security, our discussions should address all potential sources of risk, whether natural, inadvertent, or intentional. For its part, the UN system has been trying to address these issues holistically through the establishment of a UN Biorisk working group, which Dr. Mike Ryan from WHO and myself co-chair. The group is an example of the kind of cross-cutting approach we need to effectively face such challenges. Ladies and gentlemen, during last year's informal thematic consultations organized by the President of the General Assembly on our common agenda, the United Nations was invited to develop a new agenda for peace in close consultations with member states and in collaboration with relevant partners as part of the preparations for the Summit of the Future. Since then, I had several rounds of consultations, including in Geneva, to seek views from a broad range of stakeholders. Improving global preparedness to address biorisks has been a frequent matter of discussion and raised as a priority by many. I am hopeful that the new Agenda for Peace, which should be issued soon, will be able to include a new ambitious vision and pragmatic solutions for biosecurity. Dear participants, it is my firm belief that addressing biorisk is a collective and global responsibility, responding to multiple factors and requiring a multiplicity of actors, many of whom are here present. As I conclude my remarks, therefore, I remain confident that your deliberations will be fruitful and will take us closer to our collective goal of biosecurity. Thank you for your attention.